Create a client presentation with Kimberlyn Norman, Carly Scott, and Shalina Waldron.
Mr. Williamson is an 82-year-old male that was a Zamboni driver before he retired. He likes to watch football with his friends while drinking whiskey and smoking cigars while sitting in his worn-out recliner. Mr. Williamson has a history of atrial fibrillation, shortness of breath, congestive heart failure, hypertension, and type 2 diabetes. His daughter lives with him and monitors the fluctuations he has in his vital signs and underlying issues, including weight, blood pressure, heart rate, respirations, and blood sugar. The daughter noted that the patient's blood pressure has been increasing and weight gain of 5 pounds in 3 days has occurred. She says the patient's legs have been swelling and her father has had a difficult time putting shoes on. She also notes his fasting blood sugar has been high, ranging between 190 and 230 upon awakening.
Upon arrival, Mr. Williamson's vital signs are as follows. Blood pressure was 170 over 100, heart rate was 110, apical pulse was 108, temperature was 97.9 degrees Fahrenheit, respirations 26, and his pain on a scale of 0 to 10 was a 7.
Mr. Williamson's lab results are iron, which is 55, white blood cells, which is 6.3, red blood cells, which is 3.58, hemoglobin, 8.5, hematocrit, 28.1, platelets, 271, creatinine, 1.37, EGFR is 36, and his BUN is 16.
Head to toe assessment. Neurological. Confused to place in time, follows commands. Respiratory. Crackles in lungs, respirations 26 per minute. Cardiovascular. S1, S2, and S3. Apical pulse, irregular. Pulse, upper extremities, 2+. Femoral, 2+. Dorsalis pedis, 1+. Posterior tibial, 1+. IV inserted 11-19-20. Location, left medial cubital fossa. Gastrointestinal. All quadrants active. Diet, CCHO. Glucose, 238. Last bowel movement was today. Abdomen is distended. Genitourinary. Voiding without difficulty. Urine is dark and cloudy.
Integumentary. Cool and clammy, intact, edema 2+. Braden scale. Sensory limited, moist skin, walks occasionally, slightly limited mobility, suspected inadequate nutrition, no apparent problem with friction, total score 17, mild risk. Pain scale. Throbbing and stiff, 7 on a 0 to 10 scale, with back pain, constant pain, medication, heat and cold helps, patient says pain of 5 is tolerable. Wilda assessment. Grimace or frown, legs are restless, intense, patient is squirming, moans and complains difficult to console. Score 6. Morse fall scale. History of falling, yes. Secondary diagnosis, yes. Assistant when walking, IV access, weak gait, oriented to ownability, total score 60. Up high risk.
Medication list is taking Lasix, also called furosemide. It's a loop diuretic. Major side effects are vertigo, dizziness, headache, blurred vision, itching or rash, electrolyte imbalance. Implications would be for us to monitor blood pressure and pulse before and during administration, monitor his daily weights, his intake and output ratios, edema, lung sounds, skin turgor, and mucous membranes. This medication will reduce edema, which is caused by conditions such as heart failure, liver disease, and kidney disease. It can lessen the symptoms such as shortness of breath and swelling in the arms and legs and abdomen. It can also be used to treat high blood pressure. His next medication, glucophage, which is also called metformin, is an anti-diabetic. Major common side effects are physical weakness, upper respiratory tract infection, low blood sugar, and abdominal pain. For this medication, we would monitor his blood glucose before and after administration. and monitors cardiopulmonary status throughout the course of this therapy. Patient's currently taking this medication because metformin lowers the blood sugar levels by improving the way that the body handles insulin. Proper control of diabetes may also lessen the risk of heart attack and/or stroke. Now, Lipitor, it's also called atorvastatin. It's a lipid-lowering agent. Major side effects are myopathy, hyperkalemia, elevated liver enzymes. We monitor CPK levels, monitors blood glucose, as Lipitor may cause an increase in blood glucose levels. This medication, it is used to lower bad cholesterol and to reduce the risk of stroke, heart attack, and other heart and blood vessel problems.
Nursing diagnoses related to vital signs and lab values. Risk for pressure ulcer related to decreased cardiac tissue perfusion, as evidenced by stage 1 ulcers on high pressure areas. Next is risk for decreased cardiac output, as evidenced by increased blood pressure, increased heart rate, increased weight gain, and history of hypertension and atrial fibrillation. Risk for fluid volume overload related to compromised regulatory mechanisms, as evidenced by decreased cardiac output due to congestive heart failure.
Nursing care plan number 1 for Mr. Frederick Williamson. Nursing diagnosis is risk for pressure ulcer related to decreased cardiac tissue perfusion, as evidenced by stage 1 ulcers on the sacrum and heels. During his assessment, the objective data is discoloration on bony prominences and warmth, poor circulation to extremities, weak pedal pulse, and edema. Subjective data is patient states pain in bony prominences, patient states numbness and tingling in extremities, and patient states that he sits in his worn-out recliner most of the day. His overall goal is to reduce redness on his bony prominences. Patient needs to participate in prevention measures for skin breakdown. Patient repositions every 2 hours. His expected outcomes are the client uses the trapeze bar to reposition every 2 hours. Client participates in range of motion exercises. The client increases protein intake. Nursing interventions is to make sure that he is rotated every 2 hours, ensure the heel protectors are on correctly, monitor his bed sores every time the client is rotated, help the client with the range of motion exercises, use barrier cream to keep ulcers dry. Rationale for these is rotating will help to relieve pressure from those bony prominences. The heel protector will reduce the pressure on the heels. Monitor for worsening or increased redness when he's turning, and to examine for moisture on the skin. Applying the skin barrier will reduce the rate of breakdown. Increased circulation will help with tissue perfusion to increase the healing of the ulcers. Evaluation of the interventions is upon discharge, redness is decreased or under control. Client also understands how to prevent ulcers from worsening. If goal was not met, then the plan of care will be continued or revised.
Nursing diagnosis, excess fluid volume related to compromised regulatory mechanisms, as evidenced by decreased cardiac output due to congestive heart failure and kidney failure. Assessment, objective, pitting edema 2+, lung crackles, daily weight changes, INOs, and CHF. Subjective, patient states confusion, patient states restlessness. Overall goal, decreased fluid volume, increased urinary output, absence of crackles in lungs, decreased edema, and decreased blood pressure. Expected outcomes. Client limits fluid intake. Client takes meds as instructed. Client will have a balanced INO. Nursing interventions. Pass meds on time. Client teaching of restricted fluids. Monitor potassium levels. Monitor INOs. Monitor weight daily. Vital signs and lung sounds. Rationale. Lasix will help move fluid throughout the body. Fluid restriction will help reduce input and limit fluid in the body. Electrolyte imbalance may happen with Lasix. INO should be balanced. Weight will reflect if patient is still retaining fluid. Decreased blood pressure will show management of fluids. Lack of crackles in lungs will show reduced fluid volume in the body. Evaluation of interventions. Upon discharge, client will have reduced edema, reduced fluid retention, increased fluid output, and balanced electrolyte levels. If goals are not met, then care plan will be revised or continued.
Pathophysiology. Diagnosis: congestive heart failure, allergies, no known drug allergies. CHF can be caused by chronic hypertension, coronary artery disease, and valvular disease. Patient Frederick Williamson has diabetes, chronic hypertension, a BMI of 41, a poor diet, smoking and drinking. These all can result in CHF. Frederick Williamson has a family history of CHF, which increased his risk factor for developing this disease. CHF results in decreased blood volume being ejected from the heart. Symptoms will include shortness of breath, weakness, edema, coughing, wheezing, tachycardia, confusion, and nocturia.
Mr. Frederick Williamson's discharge information. Upon discharge, Mr. Williamson decided to continue his job as a Zamboni driver to increase his time out of his recliner. Mr. Williamson continues to smoke his cigars but promised to cut down on his alcohol and smoking habits. The patient was given information about therapy and non-pharmacological ways to decrease his smoking and drinking habits. The patient's daughter continues to monitor his diet and takes him to his regular checkups with his physician.